Overly flexible joints. That means joints that are hypermobile, or really stretchy skin, like when you pull up on your skin, but the skin stretches maybe farther than it does for other people. And also fragile skin. These are things when I hear about them as a family doctor, I tend to wonder about something called Ehler Danlos Syndrome. Now, we're going to talk about that today. You might have heard about it in the news. There are a number of celebrities that have come out saying they have Ehler Danlos. You might know someone in your life that has it. We're going to talk about what it is, who it affects, and what the signs and symptoms are. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Okay, so let's start with Ehler Danlos syndrome just as a syndrome. First of all, this is basically a group of disorders that affects the connective tissue. Now, I'm going to break all of that down. So it's a group of disorders, and these disorders are inherited. So it's genetic, okay? It affects about 1 in 5,000 people. And the spectrum for where the disorders fall on this Ehler Danlos syndrome scale can be anywhere from mild to life-threatening potentially. Now, the thing about it is Ehler Danlos really is as a syndrome. They're conditions that affect the connective tissue. Connective tissues are super important in our body. And you may be saying, like, what in the world is connective tissue? Well, connective tissues are proteins and substances that really help to support our skin, our bones, our joints, blood vessels, organs, you name it. It's like supporting stuff, supporting structures. It's one way I think about it. And it's really, really important. So when you have this syndrome that affects these connective tissues, people can get problems with their skin, their joints, their blood vessel walls, which is some of the main places that people with Ehler Danlos experience symptoms or problems with, okay? Now, some symptoms I mentioned in the beginning of the video still apply here. This is things like loose joints or hypermobile joints, okay? People who are like super flexible, things like that you may think about. They may have fragile or small blood vessels. People with Ehler Danlos may have abnormal wound healing, like their wounds don't heal like they should. They may not develop scars the way they should to help with wound healing, and wound healing can absolutely be impaired. Also, we talked a little bit about in the beginning, like the soft and stretchy skin. This is not an example of Ehler Danlos, but skin that stretches maybe more than would be typical for most people, and soft skin, and also skin that bruises easily, because remember I said that the connective tissues can affect so many things, right? The organs, it supports blood vessels, organs, bones, joints, and all that kind of stuff. So blood vessels can also be affected, and bruising can happen easily with these folks. As I mentioned, there are several types of Ehler Danlos. They can range from mild to life-threatening. Everyone sort of falls on a different spectrum. The most important thing is, look, if you have noticed with yourself or with your child or with sort of anyone in your life, any of these potential symptoms, or you have questions and concerns about yourself, this is always a reason to talk to your doctor. And I always say, I really appreciate all the celebrities and people who come out talking about conditions they have been diagnosed with, because the truth of the matter is, what it does is it helps the rest of us. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I hope this was helpful. Let me know in the comments if it was. Please subscribe to my channel, click the little bell for updates, and also consider joining my subscription groups on YouTube. Guys, I'm Dr. Jen. I'll see you soon.